Hello and welcome to the first in a series of talks from Fowler Syndrome UK. I'm David Ellis and I'm a urologist, so usually see women more towards the beginning of their patient journey. So I thought I'd start with taking you through a typical experience that some Fowler syndrome patients have. Please note that this has been combined for many people's experiences rather than being one person's actual case. Hopefully this will be useful for patients and healthcare professionals alike. Fowler syndrome is a condition that causes urinary retention. That's an inability to pee, to empty your bladder. Now, this is something that most people and most doctors associated with men of a certain age with big prostates. However, the person who walks through the doors of A&E is a 24-year-old woman. She's generally well, but she does have a history of Ehlers-Danlos syndrome, which is a connective tissue disease, and had a traumatic childbirth 18 months earlier. Ever since, she has been experiencing urinary infections about every 4 months. She hasn't been able to pass urine for almost a whole day, and this is getting extremely painful. The nurse she is dealing with isn't sure that young women can go into retention, so leaves a catheter lying around in the cubicle and leaves the tap running for a long time while washing her hands. So 2 hours later, she still hasn't passed any urine, surprising the nurse, who tries to pass a catheter, which is a thin, flexible tube that is used to drain the bladder, but she is unable to pass it. Even with strong painkillers, the patient is in a lot of discomfort. So they call a urologist, like myself. And the urologist arrives, but even clearly being able to see where the catheter needs to go, it's too painful for him to pass. And in the end, she needs to be given a general anaesthetic, which does allow successful passage of the catheter, and over 1 litre of urine is drained, more than double a typical maximum capacity of a bladder. The next day, she's discharged, and the urologist tells her that he hopes that the problem will settle, and it may have been down to an infection or stress or a combination of the two. And she's given antibiotics to cover for infection and is booked into the TWOC clinic. Now, TWOC stands for trial without catheter, where the catheter is removed in a situation where it can be checked that it's successful. Unfortunately, though she does not have an infection anymore, the same happens, and an ultrasound scan shows she has 900 millilitres in her bladder. So a catheter is successfully inserted, though it does require a large amount of local anaesthetic gel. So we now have a problem. She has a cystoscopy, which is a camera test, and the bladder looks normal, but she's stuck with a catheter. While it's better than not being able to pass urine at all, it's uncomfortable, it gets in the way and causes further infections. So what happens next is a merry-go-round of referrals, ideas from many doctors and other healthcare professionals. Is it a gynecology problem? Could it be multiple sclerosis or some other neurological problem? Is she taking some medication or other substances? Does she have a sexually transmitted infection? Is there a psychological problem? But the answer to all is a clear no. So she finds herself in another urology clinic with a different urologist this time, who reviews her case and notices 3 things. Firstly, she has had trouble with passing urine off and on since she was a teenager. Secondly, she has a connective tissue disorder. And finally, her traumatic childbirth. She wonders whether or not she might have Fowler syndrome. So what is Fowler syndrome? This is the definition that we have, which is that Fowler syndrome is a condition in which women have problems passing urine, often resulting in chronic urinary retention. This arises due to difficulty relaxing the urinary sphincter, which is the muscle at the exit of the bladder that holds on to the urine, and coordinating urination, which can result in the need for a catheter. The condition is often associated with recurrent urinary infections and gynecological conditions such as polycystic ovary disease and endometriosis. Some women with the condition may experience pelvic pain and may require opiate administration. To confirm the condition and rule out other causes, women are likely to require investigations such as urodynamics, urethral pressure profiling, and/or EMG studies. So the condition was first described by Professor Claire Fowler in 1985. Approximately 2 people are diagnosed per million per year. And there's no clear cause, but there are associations with polycystic ovary syndrome, endometriosis, hyperactivity of the urethral sphincter, and increased activity of the prudental nerve, the nerve that supplies that sphincter muscle. Other features include that most people, women diagnosed are in their 20s. They have high bladder volumes of over a litre, often lack the normal sense of urgency they would have with that much in their bladder. They frequently have to strain to pass urine, though often that doesn't help a huge amount. And they frequently report a sensation of gripping the urinary catheter when it's inserted. There's a very significant impact on people with Fowler syndrome, as you might expect from everything we've just read. The average time from first symptoms to diagnosis is about 4 years, so there's often a long patient journey between starting having symptoms and actually getting an answer. 85% report a severe or devastating impact on their life and quality of life. And 3/4 have been told that their symptoms are a result of anxiety or may just be imaginary or in their head. And only 30% of GPs are aware of the condition. So if you are a doctor or healthcare professional, please consider Fowler syndrome if some of these feature in your patient's history. Symptoms such as difficulty passing urine, straining, being unable or finding it difficult to start or stop the flow of urine, having recurrent urinary tract infections, pain or spasms in the bladder, and painful or difficult catheterization. Often they may have a background of childhood voiding difficulties, polycystic ovary disease, connective tissue disease, traumatic events, including surgeries, childbirth, and even sometimes assaults. So hopefully by now you will have at least some idea about how necessary support for those women with Fowler syndrome is. Fowler Syndrome UK is the first charity for Fowler sufferers in the world. The charity was founded by Danny Coombe, who has Fowler syndrome herself. It was registered with the Charity Commission in December of 2021 and has been operating under the direction of Coombe as CEO and 7 trustees, 11 healthcare professionals, and a team of patient volunteers. Our aim is to further the understanding of the condition and improve its treatment. And if you would like further information, please visit our website at www.fowlersyndrome.co.uk. Our main objectives are to provide resources, promote education about the condition, and encourage research and further development of the investigation and treatment of Fowler syndrome. The charity patron is Professor Fowler, the eminent uroneurologist who discovered the condition. I lead the medical board, and it contains the esteemed Professor Jalish Panika of UCLH, as well as a wide cross-section of specialties, including urologists, gynecologists, neurologists, psychologists, and psychiatrists. We also have multiple further seminars coming up, including greater detail about the science behind Fowler syndrome, the tests being used, the treatments, and how to navigate and experience the healthcare system. If you find these webinars useful, please consider donating to help us raise the vital funds we need to help with women with Fowler syndrome. Thank you very much.